My name's Peter. I'm a social researcher. I'm based at an organisation called the National Drug Research Institute, which has an office here in Fitzroy. And I've been working with people who inject drugs around hepatitis C essentially since the mid-1990s. I became very actively involved with the board of Hepatitis Victoria in the late 1990s. And again, I've just finished 6 years on the board, 4 of which I was the president of the organisation for. I've got a lot of involvement in working with people who are infected and affected by hepatitis C virus because of their injection drug use. And I'm particularly committed to ensuring that they have a voice in how we as a society deal with the issues associated with people who are living with hepatitis C. One of the most important things that I've learned through doing this work is how difficult it can be for some people to actually come in and ask for a test for hepatitis C. So some of the research that I've been doing with people has meant that I've been interviewing them about the sorts of things that they do in relation to their injection drug use, and then offering them a confidential test for hepatitis C at the same time. Them having to wait a couple of weeks for those results to come back. But as part of the process of engaging them in research, we realised that having that opportunity to also have a test for hepatitis C was an important part of the work that we did. I managed, I guess, over the last 15 years or so to probably have tested over 12 or 1,500 people for hepatitis C, and it's been really important process of that to actually give back to some people their first positive test, and to do that in a way in which it's being provided by someone who's got some empathy for them, who has an understanding of what they've been through and how difficult it can be to live with the virus, to tell your friends, your families, or not. That's a decision that they have to make themselves, but to also explain the implications that living with the virus actually has for people. We really know that most people who live with hepatitis C will not become sick for some decades after becoming initially infected with the virus, and so that can be a really challenging thing for people to come to terms with. That it's not like HIV in that way, where people can become sick quite quickly if they're not getting the sort of support that they need. And we've had to work very closely with a number of the primary healthcare services, the hospitals that have liver clinics attached to them, to encourage those health service workers to actually be sensitive enough to work with the kinds of clients that I'm working with on a day-to-day basis, and for them to understand that living with hepatitis C is not sort of something that you just take for granted. A lot of the patients that they're seeing in their clinics maybe have a very different view to the world to some of the people that I'm working with do. And it's really been important for me to act, I guess, as a bit of a bridge between those health service providers and the individual people themselves who've got the virus. I think in the future it's going to be really important to encourage people to have a much better understanding of their own health into the future, that the sorts of things that are on the horizon for people living with hepatitis C at the moment around access to really effective treatments and the way in which they can be delivered is going to be an important part of the way in which we go forward with understanding how people living with the virus continue to live their lives. We know that within the next couple of years, people's access to drugs that have limited numbers of side effects, they appear to be very much on the horizon, and we will know fairly soon whether or not the government is in a position to be able to provide the funding and the resources that people living with hepatitis C who have quite serious liver disease now, their ability to get access to those treatments will be really enhanced.